Welcome to our workshop today. Our topic is about home safety and fall prevention, hosted by Momiji, Japanese Social Services, Ehong Center, and VHA. I will quickly share some housekeeping rules. So this section is recorded. Please refrain from recording, taking photo of this section. You will receive a copy of the presentation slides after the section. You are mute during the presentation. The questions via chat will be taken at the Q&A time. It's optional to turn on your camera, and this is a very good idea for everyone to be more engaging and interactive. Hosting organizations. We have Momiji Healthcare Society. Shikake, she is the program worker from Momiji. And Rumiko, she is a volunteer and program coordinator from Japanese Social Services. And myself, my name is Fiona. I'm the program worker from Yihong Center. And also we have Leslie. She is the program director, house call program director from VHA. Today we have two presenters with us today. So we have Rosalinda Windsor. She is the occupational therapist from House Call. And we also have Jobie Antony. He is the physiotherapist from House Call. Welcome, both of you.
Okay, great. Well, thank you for welcoming us. It's a pleasure for Jobie and I to speak to you today on the topic of falls prevention. Before we begin, just would like to highlight the program House Calls that Jobie and I work for. So the House Calls program was started in 2008 by Dr. Mark Novichinsky with the goal of providing homebound seniors or those who are at risk of becoming homebound with primary care in their own home setting. And since 2008, that team has grown significantly to include, I think 10 physicians now. We have nurse practitioners, occupational therapists like myself, physiotherapists like Jobie, social workers, and we all work together to provide care in the client's home. And we have an open referral process. So we get referrals from community partners like hospitals, home care, or family members, or even self-referrals. So the eligibility criteria for our program, just to review briefly, is that you are 65 years and older, you live within our catchment, you have a valid health card, and you have difficulty accessing care in the community due to either cognitive, physical, or social barriers. And we have some exclusionary criteria that's highlighted there in the slide, that you're not actively palliative, you don't live in a retirement home or a long-term care facility, you don't have any IV or feeding tube or tracheostomy at the time of referral, or you already have access to a home visiting doctor. So if you know someone who's interested in a program, please feel free. You can check out our referral online at seniorshousecalls.ca. All right, now we're going to begin our falls prevention presentation. And today we are going to discuss why falls matter and exploring physiological changes and risk factors that can put seniors at higher risk for falls. Two, Jobie will speak to you more about the physical strategies that you can apply to help reduce your risk for falls, such as balance and strengthening exercises. And then I will speak to you about environmental strategies, modifications that you can consider in your home to minimize the risk for falls. And then finally, we will speak to you about what to do if you have a fall. Okay, now what is a fall? So according to the World Health Organization, a fall is defined as a person coming to rest inadvertently on the ground or floor or other lower level. Okay. So why do falls matter? Falls are a serious health issue for seniors. A simple trip or slip on a wet floor or a rug can lead to injuries and hospitalizations, subsequently affecting your independence, your quality of life, and sometimes leading to a long-term disability. So 1 in 3 seniors will suffer a fall this year. And falls are the leading cause of injury-related hospitalizations among people aged 65 years and older. And they cause about 85% of seniors' injury-related hospitalizations. And in 2018, the annual direct cost of falls among older Canadians on the healthcare system was estimated to be $5.6 billion. And falls and injuries can lead to a decreased, yeah. So falls and injuries can lead to decreased quality of life, loss of activity, reduced socialization, isolation, reduced mobility, loss of independence, and chronic pain. And even when falls do not cause a physical injury, there can be other negative effects. So after a fall, people may develop a fear of falling. They may avoid certain activities or exercise, which puts them at higher risk for falls because they become even more deconditioned. And it becomes a bit of a vicious cycle. And in fact, 50% of seniors who fall will have a second fall within a year. And of course, for seniors, falls can sometimes also lead to premature admission to long-term care. So all of these stats that I just reviewed, it might seem like doom and gloom, but the very good news is that many falls are preventable. And by raising awareness of the falls risk factors, we can then discuss strategies on how to modify and reduce these risks to optimize your safety and function.
Yeah. So to understand how to prevent falls, we first need to talk about what causes them. And falls usually happen when several factors interact. For example, an individual with diabetes who has reduced sensation in their feet might trip over an extension cord while going to answer their phone. So I want to take some time to break this down step by step, starting with physical changes. And physical changes are a very natural part of aging, and that can increase risk of falls. As we age, we lose muscle mass and strength, which affects our mobility and our stability. And aging also brings changes in vision, and slower reaction times, both which contribute to a higher risk of falling. In addition, as you age, your bone density decreases, which increases your risk of fracture. Environmental hazards also play a major role in falls. In our example, the extension cord represents that environmental hazard. And a fall can happen if a person doesn't notice the hazard or they react too slowly after noticing it. And the hazardous situation of rushing to the phone also plays a significant role. Other risky situations could include being distracted or multitasking. Finally, certain medications and underlying medical conditions, like diabetes, for example, can also play a role in increasing your risk of falls. So, in summary, falls are really caused by many different factors. Therefore, effective fall prevention strategies needs to address each of these factors independently as well. So, our presentation on the next slide will focus on removing hazards, exercise, and compensatory strategies for preventing falls. With that in mind, it's important to tell your doctor if you've had a fall, even if they didn't ask. Because, as mentioned, medications or underlying medical conditions can contribute to falls, and your primary care provider can help manage these factors. Now let's take a closer look at the physical strategies we can use to reduce the risk of falls. So I like to start with the Canadian 24-hour movement guidelines for adults age 65 and older. And they recommend getting in at least 150 minutes of moderate to vigorous aerobic activity per week. This could include activities such like power walking, using a stationary bike, playing pickleball, really anything that gets your heart pumping a little bit. In addition, it's recommended to perform muscle strengthening activities at least twice a week for all major muscle groups in your body, and included exercises that challenge is your balance. So I know what you might be thinking. It sounds like a lot of work, especially if you're not being used to being physically active. So you don't need to start at this level right away, but it's a great long-term goal. Even starting with 5 to 10 minutes a day of planned, organized activity is an excellent first step towards improving your overall physical activity levels. The key is to find something manageable and enjoyable so that you can stay consistent. And other ways to reach these goals can include social activities like group sports, social walking, and etc. So I'm often asked, what is the best exercise for me? And the best exercise is just the one that you enjoy. It's a good idea to tailor your exercise to your personal goals, and this can help increase motivation and consistency. And it's also important to choose activities that fit into your lifestyle on the next page. So, what about if you have pain while exercising? It's important to not let pain stop you from staying active, because if you completely avoid activity because of pain, you'll gradually lose your ability, your strength, and independence. Instead, you want to focus on modifying the activity and moving safely. Let's take a look at a common example, hip or knee joint pain caused by arthritis. So, firstly, you shouldn't push through any sharp pain or pain that gets worse over time. If you have knee pain, start slowly and use warm-up to prepare your body before walking. For example, you can try extending and bending your knee 5 to 10 times before walking to help reduce stiffness. And you can also take prescribed pain medications 30 to 40 minutes before activity. Finally, you can also modify the task itself. Using tools like walkers or canes can help reduce stress on painful joints, and it allows you to walk with less pain and more confidence. Okay, so typically that's been a lot of talking, and I usually get people up here, but just for the sake of time, I just want to show you some examples today of exercises you can do every day at different levels. So this is one of my favorite exercises, and it's called the sit to stand. It's done exactly as it sounds. You can use your arms to help if you're needed, or try to only use this to use your lower body by keeping your hands on your chest. This exercise is really important because it's the ability to rise from a chair or toilet or a bed, which is essential for all daily activities. It works on the largest muscle groups in your lower body, and it's really important for mobility and strength. It also gets your heart bumping, so it's a good cardiovascular workout. Yeah, so it's good to try to do it 10 times. But we're going on to the next exercise, marching on the spot. So this one, you want to make sure you're holding on to a stable surface, especially if you have difficulties with your balance. If you feel stable or confident you won't fall, you can keep your arms hovering over just to provide an extra balance challenge. This exercise mimics walking pattern, and it's a really good way to improve dynamic balance and coordination. Good. And the last one I wanted to show you here is just calf raises. And you could either do them seated or standing for a greater challenge. If you're standing, again, hold on to something stable. And this helps strengthen your calf muscle, which plays a large role in balance and walking. So before I pass it back off to Rosie, I want to share a little bit more about gait aids and why use one. So using a gait aid can help you feel steady when walking. It also reduces your chances of tripping or falling, and it makes it easier to stay active and independent. There are many different types of gait aids. Canes are helpful if you need a little extra balance and support. Walkers provide more support for those who have greater balance challenges, and they can come with wheels or without them, depending on your needs. To use one safely, it's important to make sure the height is adjusted so that your elbows are bent slightly, similar to when you're holding a shopping cart. The handle should line up with your wrist crease when you're standing, when your arms are relaxed at your sides. You should also check the rubber tips, wheels, and brakes regularly to make sure your aid is in good condition. To get the right gait aid, you can speak to your occupational or physical therapist or doctor so they can help you choose the best one for their needs.
All right, now I will speak to you about some environmental strategies and modifications. 50% of falls that cause hospitalizations for seniors in the home happen in the home. So it's important to take a closer look at the falls risk factors in the home to help improve your safety. So I'll speak to you first about proper footwear. One of the first things I notice when I go into someone's home for a home safety assessment is what someone is wearing on their feet. Feet are the foundation of your body, and how they fit and support you will have a direct impact on your mobility. So when choosing shoes, you should look for shoes with a non-slip rubber sole that provides a good grip on a variety of flooring, something that has closed heel that prevents the shoe from slipping off easily, a heel that's rounded and no higher than, approximately 1 inch. So avoid those high heels, which can certainly affect gait and balance. Shoes should fit snugly and provide good support. So if a shoe is too large, the foot can slide around in the shoe and cause instability and affect balance. And if shoes are too tight, it can cause pain and discomfort. As you age, your shoe size, the length and the width can also change. So you should have your feet measured to ensure that you have the correct sizing. And finally, adjustable closures like Velcro and laces can help to accommodate size fluctuation from swelling. So things like running shoes are a great option for footwear. For lighting and flooring in your home, you should make sure you have adequate lighting and that light switches are easy to reach. So you want to avoid having to navigate across a dark room in order to turn the light on, especially important if you have visual impairments that might affect your visual acuity in dim environments. Night lights and motion detector lights are also useful at night, especially if you're up frequently to toilet, and you can place these in the hallways or in the bathrooms to make sure you can see where you're going. You want to have clear and open pathways to ensure adequate space to move around, especially if you use a gait aid like a walker or a cane where you're going to need more space to move around. And you certainly want to remove hazards like loose cords or stacks of books or boxes that can be tripping hazard. And consider the flooring type in your home. So, for example, if you have tile or wooden floors, you certainly want to avoid wearing socks only because this can be very slippery and cause falls. And also be aware of uneven flooring or steps. Get them repaired as soon as possible. Beware of rugs or loose scatter rugs as well. If you have a rug, use a non-slip pad or secure the bottom with some double-sided tape to prevent slips and trips. And thicker carpets can pose a tripping hazard, so you should be aware of any changes in flooring and thresholds. And finally, when using stairs, if you need to use them, make sure that you have handrails for support. Consider how steep the stairs are and whether the ice or snowy conditions allow for safe use of stairs. Now we're going to look at bathroom safety. So another high risk area for seniors is the bathroom. You'll find slippery and hard surfaces everywhere, and you're often moving in and out of smaller spaces, making it easy to fall and sustain an injury. So you can consider a bath chair if you have difficulty standing or maintaining balance. It can help to reduce the risk of slips and falls and support your independence with bathing. Grab bars offer support and stability when stepping in and out of the shower, and really important for individuals with mobility limitations. Non-slip bath mat is also important in prevention of slips in wet environments. Handheld shower hose, a long-handled sponge offer convenience and control, and also promotes independence when showering in a seated position. And if it's difficult to step in and out of a standard tub, one option is a tub cutout, which you can see in the picture on the slide, to help improve accessibility. And this modification helps seniors step in and out more easily with a reduced step in height. And you want to make sure you keep towels within reach to avoid overreaching or bending that can cause a loss of balance. And also wet floors, if you're dripping on the floor, can also cause slippery conditions, increasing the risk for slips and falls. And finally, if you are feeling unsafe to shower alone, you should ask for supervision or assistance with showering to improve your safety. So next is toileting safety. So sticking to the bathroom. You want to make sure your toilet seat height is a comfortable height so you can easily get up and down. If your toilet seat is too low, you may struggle to get up, putting you at increased risk for loss of balance and falls. And also, just like in the shower, a grab bar can offer support and stability when getting up from the toilet. So if a grab bar is not possible in your bathroom, a toilet safety frame is another option. If your toilet seat is too low, you can use a raised toilet seat like the one on the picture there to increase the height. And raised toilet seats come in a variety of different heights and depending on an individual's needs. And sometimes individuals might have urinary frequency or urgency. And if their mobility is impaired, this can certainly pose a risk for falls if they're rushing or it creates wet or slippery conditions. And so in this case, incontinence products or bedside commode should be considered to help manage the toileting needs and minimize the risk for falls from rushing. And important piece being here that you don't rush. And similar to a toilet seat height, it's important to look at your bed and chair heights so that you use regularly so that they meet your functional needs. So a seat height of 17 to 19 inches high is usually ideal for most people. Of course, this will vary depending on someone's stature, their height, their condition. And so when looking for an ideal seat height, you should check to make sure that your feet are flat on the floor, your knees are about 90 degrees or slightly higher. And just like the toilet, if your chair or your bed height is too low, it makes it more difficult for you to get up into standing and increases your risk of losing your balance and falling. So you really want to try to sit on chairs with armrests that are a good height. So you can also use the armrests for support and stability. And you can also consider other assistive devices like a bed rail, a pole, furniture risers to help with your transfers. And for some, things like an electric lift chair is an option where it can help you up into standing. And just to highlight that you should be assessed by an occupational therapist to ensure that the equipment or the devices that you want are appropriate for you and your environment. And finally, moving into the kitchen environment, here you will also want to be careful with throw rugs, making sure that they're secured and they won't flip up and cause a trip. You want to wipe up wet or greasy spills right away to prevent any slippery conditions. And you want to also set up frequently used items within arm's reach, usually at elbow or shoulder height, somewhere where it's easy for you to reach so you avoid bending or overreaching, which can sometimes cause a loss of balance. And if you need to reach something that's high up, last resort, you can use a small step stool if that's safe for you, or wait and ask for assistance. And finally, what to do if you have a fall. So prior to hopefully no one will have a fall, but before this you want to be prepared. So here's an infographic from the Toronto Public Health that you can refer to, but it's really important that you have a plan if you fall. So you want to make sure you keep telephones in the rooms that you use most often, or you keep your cell phone with you within reach at all times. Keep a list of emergency contacts near your phone or stored in your cell. Use a falls detection pendant or bracelet if you live alone and you're at high risk for falls. And you could also find a daily phone buddy for check-ins. So you'll see here, I'll just review quickly the infographic. Usually Jobie and I are demonstrating this, so it's easier to follow. But if you do have a fall and you don't panic, but if you assess that you feel like you can get up, you want to roll onto your side, push up into a sitting position, try to turn onto your hands and knees, crawl to a nearby stable furniture like a bed or a chair, and then place your hands on the seat, like in number 3 there on the picture. And then place your one foot, usually the strongest foot, flat on the floor. Lean forward and then push up with the other foot into standing. And then you want to sit and rest. And then most importantly, tell someone that you've had a fall. If you fall and you are injured, it's important not to try to get up yourself. Try to get help by dragging yourself to a phone to call 911 or activate your falls pendant or call out for help. While you're waiting for help, try to keep yourself warm. Use a nearby blanket or a coat, or just move your limbs around just to keep your circulation going. If you're wet, because sometimes in these cases your bladder might go, try to move away from the damp area as best as possible and keep warm.
So if you need a physiotherapy or occupational therapy referral, you can always ask your doctor, especially if you've had a fall or if you're at risk for falling. You could also be eligible for occupational therapy or a physiotherapy assessment through Ontario Health at Home, which is covered by OHIP. And you can call the number on the slide here for more information. There are other private therapy options that are not listed on this slide, so we have 3 here. And this slide is not a complete list, and it really doesn't represent an endorsement for any specific service either. And that is our presentation today. Thank you for listening, and I hope it was helpful. We're leaving room for space now for any questions, so please feel free, and we'll be happy to help.